Good afternoon, Mr. Chairman and members of the committee. My name is Tony Landry. Excuse me. I'm in a lot of pain sitting in that chair for so long, but I'm happy to be here today. I have a written testimony, and then I have some notes taken on the agenda for the meeting I'd like to speak on. I'll just start with my testimony. Good, my name's Tony Landry. I'm a Cajun from Jennings, Louisiana, a 6-year Navy veteran serving from 1988 to 94. I was honorably discharged with a non-combat related injury. Unlike many here today, I am not here to fight for Louisiana's cannabis business opportunities. I am representing Louisiana Veterans for Medical Cannabis, a group made up of both veterans and civilians who support safe, affordable access to plant medicine. LVMC's mission is to train advocates in Louisiana drug policy reform. I carry with me a 100% organically grown hemp American flag as a symbol of veterans who have fought and died during their service or after returning home. This flag has been carried twice in the U.S. Capitol, in Arizona, and Louisiana's capital during my advocacy work. I'm here today to speak for LVMC members incarcerated and disabled veterans who can ill afford the expense of Louisiana medical cannabis or the expense to be here today. I come before the committee in strong support of legalization of cannabis and other medicinal plants such as ayahuasca, ibogaine, peyote, psilocybin, etc. Many of Louisiana's 290,000 veterans are returning from 2 decades of horrific war abroad. In the past decades, we have faced multiple catastrophic weather events at home. These historical hardships are causing unprecedented mental, physical, and financial trauma, and many veterans are turning to alcohol and pharmaceutical drugs as a coping mechanism. We are especially vulnerable as we suffer a greater amount of physical and mental issues related to service to this country. The Veterans Health Administration use of pharmaceuticals is compounding the danger due to a higher risk of addiction and overdose. Many vets are finding relief from pain and able to cope and process the trauma with plant medicine, but are forced into a dangerous underground market where they face arrest for simple possession of these natural substances. After leaving the military, I went through several surgeries to treat my injuries. After taking high doses of opiates for over a decade, I became tolerant to the opiates and turned to alcohol to ease the physical and emotional pain. This led me to develop behavior patterns and severe alcohol misuse disorder. I moved to Arizona to gain safe access to cannabis. Although the cannabis helped reduce my alcohol consumption, the behavior patterns were entrenched, and drinking was on my mind every conscious moment of my day. After attending a psychedelic conference in Tempe, Arizona, in February 2019, I found myself in an ayahuasca ceremony in June of that year. On the night of the ceremony, I had an out-of-body experience and saw a 30,000-foot view of the life and the hurt I was causing to everyone around me. When I got home, I poured 4 remaining beers down the drain. I have had difficult emotional, physical pain on occasions since then, but always reflect back on how life was with the alcohol, and I've had not had an alcoholic drink since then. Homegrown medicine and community gardens are therapeutic and nurture skills that can address community problems like addiction and overdose. Access to education, health, nutritious food, medicine, and jobs providing physical activity are hallmarks of safe neighborhoods. The Louisiana cannabis monopoly and its multi-state growers does nothing to improve our communities. Legislators are tasked with improvements to the medical cannabis program and creating an adult-use plant medicine market. Promoting home-grow micro-businesses, local business, and food security and affordable access to medicinal plants will help stem the disconnect by mass incarceration, catastrophic storms, unemployment, and the ever-prevalent opiate crisis. One of the things I want to mention today, we heard a lot about cannabis and misuse of cannabis, but at no time did I hear the word endocannabinoid system. You know, whether we call, it regulated market or illicit market, I think it's been said many times today that cannabis is still here. And many times people use it. You can call it a recreational use, but it's actually supplementing their endocannabinoid system. And they may be depressed or have some anxiety. And the cannabis is working on receptors in their brain that help those ailments. So we also heard, we didn't hear anything about, we're under an opiate overdose crisis right now. And I didn't hear anything about limiting the pharmaceutical pharmacies. We still adding new pharmacies that sell opiates, but yet we having surges in opiate overdose death. We heard a lot about alcohol. And same thing. No limits on retail sales of alcohol. Impairment. We heard a lot about cannabis impairing. You can be impaired by working a double shift with 14 hours of work. I have some arrest data showing that Louisiana is number one out of the 7 local states around us. Our population in the state is 4.5 million, and yet we incarcerate more than Texas with 29.2 million population. I added in my package also the Louisiana parish per capita income ranking. And if you look at the jail and prison populations and the parishes that they're in, they're all from the lowest socioeconomic parishes. So that's some things to consider, when we discuss cannabis and arresting people for this plant, which over 38 states it's legal to use, and many states you can grow it. I want to just mention briefly, I know we've been here quite some time, on the agenda items for the meeting today: establishing and maintaining procedures to regulate and produce cannabis. I think the police involvement, we should police the dispensaries, because as a patient in Arizona, oftentimes I'd get cannabis and bring it home, and it caused some severe throat irritation or something. But I had no recourse for my action. They have Arizona Department of Health was monitoring the cannabis program, and the procedure was just to file a report, and I did before I left the state, and I still haven't heard anything back. If the dispensary was fined or in no recourse for refunding my cannabis. And my only source was to pay. I checked around at testing facilities, and they wanted $700 to have the cannabis tested for heavy metals or pesticides or whatever was causing the inflammation. And I feel like if we give money to the sheriffs, we should have them be able to have a testing facility where patients or consumers can bring the cannabis if they suspect it of being contaminated, and the sheriff investigate the dispensary. Number 2, on establishing public protection for minors. I think there is education, keeping cannabis in unregulated in the illicit market. We're not protecting minors there. Whatever cannabis that's available, it's going to be from illicit growers. So that's not protecting. And with the access to the internet and dark web, there's much more dangerous chemicals that aren't part of our endocannabinoid system, or they have a way far detrimental effect on children. Establishing public safety protection. I think we should develop a state seal on the cannabis and have it hermetically sealed, at the packaging facility, to where when it's sold, okay, well, it's safe. The state sealed it and it's protected. establishing, creating rigorous testing, very important. The state should be able to do spot checks at the dispensary. I notice, just go in and sample a few packages and test it and see if it's contaminant. Providing equity. I think it's important to have small farmers in a parallel marketplace, not have people just with large financial resources be able to sell cannabis, but have a small farmers market area where the cannabis can be tested and they go into a certain area and sell only a certain amount. Have a small footprint and access to the market. Evaluate effects and impacts of potential legalization. On the medical cannabis, I think making the insurance pay for it. Like we're working, Veterans Action Council is a group I'm in. We're working on getting the VA to pay for our veterans cannabis, because Canada and Israel and a couple other countries pay for their veterans cannabis access. Evaluating best practice for potential tax structure. I think that's training. Mental health checks for law enforcement. If you're going to give some money to law enforcement, have them go through. We're seeing surges of state police violence. In the news today. Well, part of that reason is we're not, having mental health checks, regular health checks for our officers. They sometimes they might need a break from all the the things they're going through that's causing the violence. Limit the net wealth of people that enter the market. We're seeing on an international scale, international companies are consolidating the market and monopolizing the market, and on the local level, it's happening in Arizona. It started out with maybe 130 dispensaries, and they're getting gobbled up. The equity licenses that they came out with is for Prop 207 while I was there. The dispensaries are co-opting the equity licenses, and it's just a name on the wall. The equity license is not really meant what it was meant to be for, and there's current litigation in the state for that. Yeah, that's about all I have. I know we've been here a while today, and and also one last thing, we keep hearing about the illicit market up in Oregon and how they're spending millions of dollars, and part of the reason that is the federal government has to step up and regulate cannabis, because there are only two choices. It's already here. It's either regulated or allow the illicit market to sell it. So that's the only choices. Since 2013, there's been a 78% decrease in cannabis seizures at the border. So, that tells you it's not coming across the border anymore. The cartels and they're coming into the states that it's legal to grow and shipping it to the states that it's not legal to grow. So that's why we're seeing the illicit market explode in those other states. And I think that's all I have to say today. If I'm open to any questions, if anybody has any questions on anything I say, and I'll be happy to provide some more data on anything I mentioned today.
Say thank you for your service to our country. I need you to stick around till it's over so I can give you my email, so you can email me the different things you had listed for input.
Yes, sir.
So we can put it in our report. I'm very grateful. Thank you.
Thank you, Chairman.
You got it.
Committee.
Is Mr. Kevin Caldwell still with us?